Observational study of various spinal disorders regarding correlation of radiological and clinical parameters. Today various spinal diseases are diagnosed by means of clinico-radiological methods such as X-ray, MR imaging and CT scan. Need of such investigations is essential to have idea about the pathology one is going to treat intraoperatively. Many times clinical and radiological diagnosis is not consistent with operative findings. Therefore, surgeon is at a loss to choose proper operative procedure planned preoperatively. An attempt has been done to correlate clinico-radiological findings with operative findings of 40 cases selected prospectively at this orthopedic and trauma hospital. This is a prospective study of 40 cases of various spinal disorders performed at Orthopedic and Trauma Hospital, Miraj, Maharashtra during the period from February 2009 to January 2011. In the present study of 40 patients, there were 31 males and 9 females above the age of 20 years. Most of the patients were initially seen on outpatient basis. Detailed history was taken and thorough local, as well as neurological examination was carried out. The commonest age group affected was 41 to 50. 75% of cases were above 40 years of age. Males are affected more than females. 77.5% of patients were males. In present study, PID was most common spinal disorder. Manual workers and farmers are more affected. Most affected level is L4/L5 disc. Sagittal diameter was measured at MRI sections and its relation with difficulty during operation was noted. It was seen with narrower the diameter more the difficulty during operation. 40 cases of spinal disorders were studied. All these cases were studied at Orthopedic and Trauma Hospital, Miraj during February 2009 to January 2011. It was found in present series that commonest age group affected was 41 to 50. 75% of cases were above 40 years of age. Conclusion. More sections are required at the level of intervertebral disc and nerve root foramen to detect foraminal stenosis, subrachal disc prolapse, and nerve root compression. Gadolinium enhanced MRI should be done preoperatively in repeat surgery to assess the element of fibrosis. MRI may underestimate nerve root tension, hence special efforts needed intraoperatively to estimate nerve root tension. If found, appropriate procedure should be followed. MRI is oversensitive to disc pathology. Good clinical correlation is required to deal with pathological disc lesions at the time of surgery.